Good luck, babe. Chappelle Roan, 19 minutes past 10. Good morning, Malaysia. Otto here, coming to you live from Angkasa Puri, Kuala Lumpur. Also on our TikTok Live and also Facebook Live at TRAXXfm Official. That's TRAXXFM. We have a special interview session in this hour, and it's going to be about Cervical Cancer Awareness Run. And today in the studio, we have Dr. Jamil bin Omar, a consultant gynae-oncologist, Institut Kanser Negara, Ministry of Health. Good morning, and thank you so much for coming to the studio, Doctor.
Yeah, good morning. Thank you very much for inviting me.
Now, you have been in the medical line for over 30 years,
Yes.
am I correct? And as a consultant gynae-oncologist, did I pronounce it correctly?
Yeah.
For 14 years already.
Yep.
14 years. And have you seen any reduction in terms of patients in your years as a gynae-oncologist?
Well, I think over the years, the numbers are increasing. But then what I can see is that the stages that we detect the cancer is much lower as compared to previously, where most of the ladies come at late stages.
Oh, so you're saying that due to the fact that they went for the screening first, early screening, they managed to treat the cancer early.
They managed to detect and treat the cancer early. Whereas last time they came at late stage, so nothing much can be offered.
My goodness. Okay. So once again, if you have any questions for those who are online right now, you can leave a comment in the comment section or just give us a call at 0322825491 or 0322824746. Now, without further ado, Dr. Jamil, can you briefly explain to us what is cervical cancer?
Well, cervical cancer is the cancer occurring at the cervix or entrance of the womb. Okay? So literally it means the lower part of the womb which meet with the vagina. So it is mainly caused by human papilloma virus. If you talk about other cancers, doctors will tell you we do not know why this cancer happened to you. But then for cervical cancer, majority, I would say about 95 to 98% is caused by human papilloma virus. And this virus can be easily detected, so therefore we can identify the cancer early.
Now, doctor, how important is it for early detection?
Well, early detection for me is equivalent to cure, because when you catch cancer at an earlier stage, the likelihood of cure is very much possible compared to when you catch the cancer at late stage. So how do we screen or how do we detect this cancer? We have two tools for screening. Firstly is pap smear, and pap smear has been in the market or in place for more than 100 years. And the new tools is human papilloma virus DNA test, or easily called as HPV DNA test. So by doing this test, you can detect abnormal cell from pap smear, or better still, if you do HPV test, you can detect the organism that caused the cancer, which is human papilloma virus.
And how long has this been in the industry already?
HPV test, I think, has been there since 2000, earlier 2000.
Oh, still new.
Yeah, but then make it commercial maybe about 5-6 years ago in Malaysia.
And how's the response so far?
So far, the response is good, but then it does not make it tremendously more than what pap smear has been offered last time.
Mm-hmm.
I think because people feel that I'm healthy, why should I go and screen? Number one. Number two, and they say I'm worried if I can detect something bad, I'll be in trouble. But then we have to understand that when you detect something early, it is almost curable, as I mentioned earlier.
And when it comes to the difference in pap smear and HPV DNA, is there different in terms of payment, or cost is different?
Okay. So I think in terms of payment, actually both are two different tests. Pap smear, you can do it much cheaper, but the thing is that it has to be done by medical workers or medical personnel, either doctor or nurses. Whereas HPV DNA test, a lady can do on their own, at their own place, at their own safe or
at home, if they're too busy to go see the doctor, they can do it at home.
In fact, for HPV DNA test, you can do it in private clinic or hospital And in government setting, in the larger clinic kesihatan, they are offered for free
Oh,
HPV DNA tests.
so what are we waiting for? Okay, what are the common symptoms, doctor?
Okay, talking about cervical cancer, early stage, most of them have no symptom because the cellular changes doesn't cause any growth. It's just that the epithelial or the surface of the skin that cover the cervix become thickened. But over the years, this process will go on and the tumor will arise from the cervix. Once the tumor arises, they will cause bleeding, especially bleeding after coitus, and some of them can bleed after excessive or activities like running or jogging, and some of them in advanced stages, they come with pelvic pain.
Now, what are the causes, main causes? Is just, for example, age is one of the factors, is it? Or is it because of how you eat, your lifestyle?
Okay, as I mentioned, this HPV cause cervical cancer. So HPV can be infected through skin-to-skin contact, specifically by sexual intercourse. So actually, generally speaking, 80% to 90% of normal men and women, 80% will be infected with HPV once in their lifetime.
Oh,
However, 90% of this infection can be eradicated naturally by our own body. But for those who have recurrent infection, those who has promiscuous partners, which usually they carry HPV, because of recurrent infection, the body take about 2 years to eradicate the infection. So
wow.
you keep on having repetitive infection, therefore your body cannot cure the disease. So this will escalate into pre-cancer and then cancer stages.
So there you go. Okay, so once again, we're talking to Dr. Jamil bin Omar, consultant Gynae-Oncologist from Institut Kanser Negara, Ministry of Health. We're talking about cervical cancer awareness run. Now, if you have any questions for our good doctor here today, you can ask the question in the comments section on our live, both on Facebook and also TikTok. Or if you feel that you want to give us a call, well, the numbers are 03-2282-5491 or 03-2282-4746. Now, before we go for a break, doctor, what about treatment? Treatments for cervical cancer. Has it improved in recent years or has it still in the research stages?
Okay, talking about treatment, we have a lot of different type of radiotherapy and chemotherapy now. But before we leave this topic, I would like to talk on something very important, which is vaccination. So for your information, ladies out there, HPV can be prevented by taking HPV vaccine. So these vaccines is in our government vaccination program. It is given through Ministry of Health, Kementerian Kesihatan Malaysia, for the girls age 13, meaning Form 1. It's given for free at the school, government school. So this one will prevent HPV infection. Therefore, they only need to do screening, like a pap smear or HPV test when they are adult.
Now, doctor, this seems to be a very serious issue as well. Now, you did say that a lot of stages in the previous interview, off air, you did say that there are less critical stages in terms of this cervical cancer, but more people are, having the initiative to actually have more screenings. Do you see the numbers going to rise even more due to this?
Actually, I'd like to correct the statement. We still see a lot of cervical cancer patients, but we see them at earlier stage, meaning stage 1A, 1B, or 2A. Last time, we see them at stage 2, stage 3, and stage 4. So nowadays, we still see many patients with cervical cancer, but at a lower stage.
There we go. So once again, just like to say hello to those who are online. Christiana Chin, hello, good morning to you. Najib Nawi, Bundal Reis, let's see who we have as well. Bundal Reis and everybody else who are online right now. Thank you so much for joining the conversation. So once again, we're going to go for a short break. But if you feel that you have a question with regards to the good doctor, let us know over there in the comment section or just give us a call at 03-2282-5491 or 03-2282-4746. We're going to go for a short break. But when we come back, we're going to talk about cervical cancer awareness and how other campaigns are going to fare about in the near future. For now, Andrea Bocelli, Besame Mucho, right here on Trax. Mucho. 33 minutes past 10. Good morning, Malaysia. Otto here on Trax Midday Buzz with a special interview feature of the day with regards to cervical cancer awareness run. And we're here in the studio with Dr. Jamil bin Omar, a consultant gynae-oncologist from Institut Kanser, Negara, Ministry of Health. Once again, thank you so much for coming to the studio, Doctor.
Right.
And recently we were talking about the things that you can do when it comes to early detection. You can either get a pap smear or even the HPV DNA, which you can get it for free for government health clinics across the country for now. And it seems that treatment is very important as well for you. Screen first and treatment. But doctor, I'd like to ask you, at what age do we actually recommend a person to do screenings?
By our guidelines, pap smear can be done from the age of 20 or whenever a woman is sexually exposed. For the HPV DNA test, we recommend at the age of 30 because, as I mentioned, when you're younger, your body can eradicate the infection naturally. So from 30 onwards, HPV DNA test is advised to be done.
Now, you did mention with regards off-air about when they turn 65.
Oh, yeah.
How was that? Yeah.
So this screening can start at 20 for pap smear until the age of 65. Same it goes for HPV DNA from the age of 30 to the age of 65, provided the 3 previous screening were normal.
Now, how often? Frequent?
Okay, for pap smear, you can do 3 yearly. And for HPV DNA test, it is covered for 5 years.
Wow. That's great. Okay. Now, with regards to cervical cancer awareness run, can you tell us more about that?
Well, this run going to happen on the 1st of June, maybe about less than a month from now. It is called the Kuala Lumpur Ladies Cervical Cancer Awareness Run. So basically, this run is for exposure and awareness on cervical cancer. So during that run event, it is like a family event from those who are aged 3 years and above can come together. Then during that running also, after that, you have this screening for cervical cancer being offered. So please take this opportunity. For those who have never done a screening, you can come for the screening. HPV DNA test, which is simple, you can do on your own. Then maybe you can get the result about 3 to 4 weeks later.
And I think having this campaign and this run together with friends and family, those with experiences, those age groups between, let's say 30 and above, can actually help out those who are still new at this, who are not aware about the whole situation, how important it is to, when it comes to your cervical health.
Yeah.
You have your seniors, you have doctors there as well joining the run. So it's a perfect time to enjoy friends and family, enjoy the day, at the same time, be aware of how important it is for your health to be on tip-top condition, particularly when it comes to a busy lifestyle nowadays. And doctor, what about the objectives of the run aside from helping out in the terms of campaigning and awareness?
Yeah. So apart from campaign awareness, it also helped to fund the local cervical cancer support initiative. So the participation will make a difference because from this support, a lot of expenses, especially, can be given to those in needs.
And when it comes to this, how much are we looking at when it comes to this?
I am not sure because those are the cost is divided by the organizers, but basically it's to fund the cancer patient or cancer survivors.
Okay. How about the participants?
Participant can enjoy the run. They can buy merchandise. And also they can enjoy the scenic venue of Lake Perdana because the run is at the Lake Perdana or Tasik Perdana.
And how long will this event last? And what are we looking at? What kind of crowd are we looking at over here?
Well, as much as we can because
a few thousands, a few hundreds?
Maybe thousands.
Mm-hmm.
Yeah.
Mm-hmm.
Because like last year, we organized this Pink October. So we managed to gather about 3,000 participants. So for this run, I think maybe equivalent or more than that.
Wow. And any advice for those who are going for the run?
I think come early and bring your caps or garment to cover because it's going to go towards the afternoon where it's hot, and maybe brings your drinks or water.
Mm-hmm. When do we start? What time should they register?
I think as early as 7:30 in the morning.
Mm-hmm. Should they have their breakfast first, or and have a
Well,
short breezy run? Or?
Yeah, maybe a light breakfast, because if you have taken a full breakfast, it's going to be difficult for you to run. But anyway, it's going to be a fun run for the family. But for those participants who want to finish the 5 kilometers, they are welcome to do so.
Okay, 5 kilometer run. Yeah, that's quite a lot. Is there any prizes for those who actually manage to finish the 5 kilometer run?
Well, I think the organizers has arranged something which I cannot speak in details.
Okay, doctor. What is your message then about and your hopes for participants who will take this event?
So I think the most important is to understand that cervical cancer can be detected early. So please do a pap smear, or if you are worried to go to see a doctor, you can do at your own leisure. Do HPV DNA test, okay? And for the girls, please get your vaccine, because once you get a vaccine, 90% to 90% you are protected from cervical cancer.
Wow. Okay, thank you very much. We're talking to Dr. Jamil bin Omar, consultant gynae-oncologist from Institut Kanser Negara, Ministry of Health. We're talking about cancer awareness run, cervical cancer, and you've heard it from the good doctor already. Get yourself screened as early as your 20s?
20s for the pap smear,
for the pap smear.
30s for HPV DNA test.
You heard it from the good doctor. Also, you can get it at any government health clinics nearby you, and of course, get professional help should you need any other further clarification as well. So that's it from today. Thank you very much, doctor, for coming to the studio and sharing with us the importance of cervical cancer to everyone who is listening in right now. And for those who are online on TRAXXfm's Facebook and also on our TikTok, thank you once again for joining the conversation and sharing and also liking the live. I appreciate it very much. So stick around. We've got more stuff lined up in this hour. So stick around. For now, Gracie Abrams, That's So True, right here on Trax.